In the small town of Moree, an hour south of the Queensland border, health staff are working overtime.
It concerns me because, we don't want anyone to actually be physically put in hospital because of COVID, because our hospital would not be equipped to handle that influx of patients.
The regional community is in the grip of its first major COVID outbreak. The first case was detected a fortnight ago. Now more than 150 people have the virus, nearly all of them Aboriginal, and a third children.
We had a scare a couple of months ago, but that was just a transient, But this is, it's here.
Staff at the local Aboriginal Health Service hoped the outbreak would prompt more people to get vaccinated, but first dose rates have risen by just 1% over the past fortnight. Only around 1 in 5 of their Aboriginal patients are fully immunised.
A lot of our elders got vaccinated as soon as they could. I got vaccinated as soon as I could because I deal with a lot of clients. A lot of people won't get it because they either Google it or they listen to Facebook.
I remember the AIDS program, the advertising for the AIDS program. I mean, that put the fear of God into everybody, and it worked. And I think that's a tactic we need to take, because the younger population aren't listening.
Concern is growing ahead of the reopening of the Queensland border next month.
Moree is the pit stop before they actually cross the border. So I reckon our cases will probably rise once they open everything up.
If the atmosphere doesn't change, we're going to have a death in Moree, and then all hell will break loose then.
The Moree outbreak is a microcosm of how COVID has disproportionately affected Indigenous communities across the state. Indigenous people account for 8.3% of positive cases since June, despite being just over 3% of the New South Wales population. Around half were unvaccinated, while almost 30% were children under 11 who were too young to get the jab.
Now, how did you fare with dose 1?
For Aboriginal and Torres Strait Islander people, this is further compounded because there's a greater risk of transmission as well as having worse impact from COVID. And this is due to the younger age distribution, higher rates of underlying conditions. Add on top of all of that a lower rate of vaccination, and what you have is, a perfect storm.
23 vaccines today. Dudley, what's tomorrow look like?
Across the border in Brisbane's north, vaccine bookings are slowly picking up.
So at the moment, a lot of our patients have mobbed down in New South Wales, so seeing their family down there and seeing the community outbreak, a lot of them are getting it.
If you're feeling nauseous, just a nice blend diet.
Local health workers say social media and complacency have been the main drivers behind the slow uptake.
I think the main thing with Queensland at the moment is that COVID isn't crazy like in New South Wales, so it's not really the first thing on people's radar at the moment.
Come into the community but don't want to listen to us. Yeah.
The Queensland Health Minister says the government has been proactive in boosting Indigenous vaccination rates, and efforts are starting to pay off. But during a visit to the Aboriginal community of Cherbourg last week, where less than a third of residents are fully protected, the Queensland Premier met some of the vaccine resistance head on.
It's absolutely right for people to get vaccinated to keep Queenslanders
14-year-old children on the streets of Cherbourg?
Very safe, very safe.
When it comes to hesitancy, head of the Institute for Urban Indigenous Health, Adrian Carson, has another theory.
There wasn't any data available to support communities to kind of inform their choice about vaccination. I think lots of percentages that were getting thrown around, plenty of politicians talking, but none of it kind of cut through a lot of the misinformation that was out there, particularly on social media, to actually make the threat real to our communities.
His organisation commissioned its own modelling, and the results are grim. It predicts that without lockdown measures, more than 400 Indigenous people could die in southeast Queensland alone over a 3-month period if COVID takes hold, while more than 3,000 could be hospitalised. The higher the vaccination rate, the lower those figures become.
At the moment, based on the current hit rate, we're talking about getting to 60% by the 17th of December, which again isn't nowhere near 80%, which is what the broader community will have some comfort in knowing that the vast majority of their people are fully vaccinated. Our people won't be there.
It's hoped the data will hit home for Aboriginal communities and help avoid a potential catastrophe.
We don't want to see what happened in New South Wales. It wasn't until people started to pass away that we saw this huge kind of uplift in vaccination rates, this huge demand for vaccine. We want to see that demand now.
That's it, done. Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.